One thing we chatted a little bit about earlier was first your exposure and experience as a urologist and some of the maybe misconceptions that existed around the prostate and testosterone, but I think also with testosterone therapies, there's a lot of resistance around potentially cardiovascular risk and things of that nature. Can you speak a little bit to how testosterone is important, not only for some of the quality of life and libido components that we talked about, but maybe how a man who's actually deficient in testosterone, that may actually increase his cardiovascular risk if he doesn't have adequate estrogen levels, and that sort of conversion process that's important for that.
Yeah, so the testosterone and cardiovascular story is kind of interesting. So there was a belief back in the 60s, 70s, maybe 80s, that testosterone maybe was bad for the heart. And the reason it was believed was that men have more heart attacks than women. Men die of heart disease at every decade more than women. And what do men have? What's the difference between men and women? Well, one is testosterone. So without much sort of evidence base behind it, but kind of speculative, there was sort of this general sense maybe testosterone was bad that way. And it disappeared as we started seeing evidence accumulate in the 80s and later that actually men who had lower testosterone had greater risk of heart disease, severity of coronary artery disease, more deaths, and increased mortality if you have low testosterone. So it went totally the opposite way, and people started getting reasonably comfortable with the idea that maybe testosterone, having a good level, was what we call cardioprotective, good for the heart. And then boom, out of a sudden, out of the blue came a paper in 2013 that got headlines everywhere. And it wasn't sort of the gold standard study, which is a randomized controlled study. You know, we have two groups, they get the same, one gets one medicine, one gets a placebo. It's what we call an observational study, where they just looked at some data. And that's fine, but it's got its limitations. And there was a study that got everybody nervous. And it was published in one of the foremost medical journals. And it looked at a group of VA patients, all of whom had undergone cardiac catheterization. So they either had heart disease, there was concern that they did. And over the next few years, some of those men, for whatever reason, received a prescription for testosterone, and some didn't. Those are the two groups. And what they concluded at the end of the period of study was that the men who got testosterone had more heart attacks, strokes, and deaths. And headline news. Everybody knew about it. Doctors knew about it, people who weren't doctors. I had patients who'd been on testosterone happily for years, and their cardiologist called them up and said, "You got to get off that stuff, it's going to kill you." And it turned out that that paper was based on the worst science imaginable. But it took a while to figure that out. As an example, a few months later, the authors first of all had to correct their initial results, and then they published a correction, and then it turned out that 9% of the all-male population turned out to be female.
That's quite the confounding variable in that study.
So imagine a breast cancer study in women where it turns out that your data set is contaminated by almost 10% men. Nobody would believe it. So there were something like 29 medical societies that called for that article to be withdrawn. In the end, it's really almost non-information. Like it's so tainted, it's hard to know whether it tells us anything. But the paper still exists. The journal decided to not retract it. But it impacted everybody's view about this. And it raised the specter of there being increased cardiovascular risks. Happily, since that study came out, there's something on the order of 24 papers that have looked at heart disease and testosterone levels, and not one has confirmed the concern about testosterone therapy and heart disease. And some of them have even shown that there may be benefits to it. And again, I think that the data suggests that it's low testosterone that's a real risk for heart disease and not the opposite.
So how would you sort of suggest, or based on the data that we have or what you've seen in patients, that that optimal testosterone level is cardioprotective? Is part of that also due to what we see with estrogen, since we know for women, when hormone levels decline around that perimenopausal time of life, their cardiovascular risk increases. That's also a time when estrogen falls. So is it potentially the aromatization or conversion of that testosterone and estrogen that's providing that benefit for men, or is there more to the story in terms of how the testosterone might be cardioprotective?
Well, most of the data and the more recent data really shows almost no difference between men who get testosterone and men who don't in terms of the cardiovascular effects. There is a very large study that was mandated by the FDA called the Traverse study that should be published within the next year, maybe 2 years. And so we'll learn a little bit more about a large randomized controlled trial from that. But there's already a fair amount of information. So there was a very large trial that was done in Australia where over 1,000 men were enrolled who had abnormal blood glucose measures. And they were at risk for either diabetes or actually had diabetes, type 2 diabetes. And it was a 2-year study, very well done. And there really was no difference in cardiovascular events for that group. That's a large study. It's a significant period of time, and that's important information. We also had the testosterone trials, which was published in 2016, which took 790 men, 65 years and older, and either they got, for 1 year, they either got testosterone gel or they got a placebo gel, and then they watched them for another year. And again, the number of major adverse cardiovascular events, heart attack, stroke, death, was actually less in the testosterone group than in the placebo group. But not enough for anybody to draw some conclusions to it. But reassuring data on that. So we already have a fair amount of data. And I think the final chapter it's my personal belief that testosterone heart disease is going to have either a neutral effect or beneficial, but I don't think that the magnitude of that effect is going to be terribly large.
What would you say to the folks that are maybe taking that more granular look at a particular marker related to cardiovascular health and the concerns about testosterone replacement therapy?
Overall, there's a wealth of data that shows that the net effect on lipids with testosterone is probably neutral. Doesn't change it much. So HDL can go down, but total cholesterol also goes down. And the reason we care about cholesterol is because of its downstream effect and it's as a risk factor for cardiovascular disease. Right. So, what we really care about is does it change cardiovascular disease? And if that doesn't change, then the cholesterol may or may not be an issue. But most of the data around testosterone and lipids is actually reassuring.
Right. That's also probably because of the metabolic benefits we see. So some of those lipid triglyceride improvements, a lot of that going hand in hand with the testosterone administration. Plus, one thing that I've seen just across the health and fitness industry, also speaking with other medical professionals, is sometimes these folks who had the poor quality of life symptoms, they didn't have the energy, they didn't really have that drive, to embark on a healthy lifestyle, or maybe they fell off the wagon of what they were doing before. If testosterone serves to maybe get in that extra workout each week, or maybe they, it kind of makes effort feel good, right, in a way in terms of having that testosterone in the body. So we do see men who are maybe previously feeling a little bit more like a couch potato. We add the testosterone to the equation, and it's a little bit of that, almost a supercharger in a way to reinforce positive lifestyle behaviors.